I mean, that brings out or illustrates the not the problem with DNS or a DNS course, but and I may have said it before on here, but it's like you take the DNS course, and if you're paying attention, you start to see, okay, this seems to really truly be the foundation for movement and stabilization. This is all I need. I mean, I teach people how to move and how to stabilize, and I'm going to get all these great effects from teaching them how to effectively and ideally move and stabilize. But as you just pointed out, the person has to be in a, central nervous, in a neurologic position to be able to do the exercise as well. If they have a joint restriction, if they have, significant joint restriction, a nerve impingement, things like that, you can't just place them into quality positions of movement and stabilization and think that they're going to, number one, be able to do them well, or that they will have the effect that you intend. Because if somebody has a fascial restriction that is inhibiting muscles, you're not going to be able to effectively stabilize and move at that point. So you do have to take a step back from just placing people into exercise positions, let alone I'm just going to do deadlifts, immediately with my back pain patients because they need to be strong. And you have to really not only work this out, but, as we both believe, it has to be done in a very rational, effective way. And that's been many years in the making. I mean, a few more years for you, but...
Well, yes, you see, and that is the thing, it is the fine balance. There are some trigger points, some fascial restrictions, all this that can be helped by using the DNS as is. But if it doesn't work, you need a backup plan. You can't sit there and hope for the best. After all, you're looking for an efficient and rapid resolution of your client's symptoms. Excuse me. Because in this day and age, you are being paid for results. And if you are a cash practice, for example, you're not seeing the patient 3 times a week ad nauseum. He's expecting that you will do something significant within a short period of time. And you have to show objectively that you are. So the challenge is to know when to move between the voluntary and positional treatment of someone and use manual therapy to assist and aid them into gaining mastery of the global movement pattern. The global movement pattern is the basis of the building of the fundamental movement. It is the fundamental movement. So I must do everything to help the patient master the global movement pattern. And even though the global movement pattern is itself self-correcting of certain aspects, it is limited by the patient's individual makeup, tissue, the length of time or chronicity of the problem, etc. So you cannot always rely on a rapid resolution by just positioning the patient and facilitating movement. Many times it will work, but if it doesn't work...
That's almost what we say is the problem.
That's it.
Is that, sometimes those developmental DNS positions have such utility and can be so effective that you get fooled into believing, all I have to do is just make people breathe and generate intra-abdominal pressure, have them move with quality, and all of the, takes care of everything. And as you pointed out, sometimes it can take care of 75% of things, but it's the remaining 25% that's a problem. And I'll point out, if when you treated me this past weekend, I was in, it was about a 50-minute treatment, 55-minute treatment. If somebody who took a DNS course were to have observed, they might have said, this is two DNS instructors. He didn't do any DNS with them. It was an hour-long treatment. He didn't do any DNS. Now, and I know that, number one, the framework and the base that you're working from, that you're thinking about even the history, is a DNS neurocentric basis that's informing your questions, your decisions, the rationale of the treatment. So, number one, in that respect, it is a DNS approach. And you were using DNS patterns to mobilize my shoulder, or to quote unquote manually treat my shoulder, to get my shoulder and head and neck in a position to then next time do traditional kind of DNS exercises. So there is, and of course you did a lot of manual therapy, which in one sense is not, a DNS technique necessarily, but it's when you understand that a manual therapy may be necessary in order for someone to do a DNS exercise, then that falls within the spectrum of DNS at that point.
Yes, it is
your understanding that you need.
Yeah.
Yeah. But if you only think the DNS principle is baby exercises, then to do manual therapy seems counterintuitive. You say, why would I do that? It's not a part of DNS.
Yes.
When in fact it is.
Yes, the principles drive so many aspects of the applied techniques, and so it should. Yeah. Technique is not principle, and principle is not technique. If you are really true to principles, then the techniques are the tools by which you can apply these principles as needed, and it gives you the freedom to move between subservient techniques that contribute to the final execution of the principle you are interested in or which you claim to master. So I'm really always true to the DNS principles because they are immutable in many ways. They are not changing, and principles should not change. If they are changing, then that's not a principle. That's good enough. You have to find a better principle that explains the one you were using and becomes more overarching. And that is what we try to do. We are always trying to build into our knowledge base principles that will become immutable, that are applied over the biggest range possible. And that is why, on seeing and understanding, having seen Yonder, Levitt, Collage, all and many others work, there are principles that run like gold veins through all these approaches that unify them in the empirical aspect of the global movement pattern, joint centration, and the role of the central nervous system in movement efficiency. That you cannot argue with, because that has been seen time and time again to be the basis of our understanding of movement analysis and rehabilitation. If you choose to use any technique or minor principle, that as long as it fits in with the overarching of principles and goals, then you are free to do so and you can explain them. A lot of the manual therapy has to do with getting joints or segments into position, or making them, or facilitating or inhibiting muscles, freeing up fascia, stretching some of the non-contractile tissues, improving proprioception, and so on. So all these aspects are still subservient to the DNS principles.
Yeah, I guess I just generally kind of categorize or think about a technique, specifically a manual therapy technique. It's they're all, as you said, subservient to, they're providing you with the capacity to now do the DNS exercise. To that's what their intent is. Whatever you're doing, rubbing, dry needling, stretching, rolfing, all of that stuff, that is to give your tissues and body the capacity to now actually perform, effectively move and stabilize.
Yes. And and we have to do this as efficiently as possible in the time frame we have and within the medical framework that we live in. I don't have an assistant. I must find a way to be as effective as possible in as short a time as possible so that I can show and demonstrate to my client that that this is an effective approach. I must know when it is not. So my diagnostic skills should be honed so that I don't waste my client's time when this approach is not the ideal intervention. And also, the cost of treatment is quite high in this part of the world. It is not one of your lesser expenditures economically by any means of the equation. So you have to deliver.
Yeah.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.